Namaste.
Today I wanted to know about this Ayurvedic enema. That is that in what way Ayurveda uses enema,
Yes.
and little bit of general information about it.
Okay. So if I do a quick recap, last time we spoke about Vamana, the emesis therapy and the purgation therapy. Out of all the 5 panchakarmas, we explained general introduction of panchakarma, and then I explained about emesis and purgation. So there are 3 more to explain, so maybe that will be relevant to your question as well, because in the remaining 3 panchakarmas, one is that Ayurvedic enema you mentioned, that is called as Basti panchakarma. Basti or Vasti they call it as. And this is basically kind of colonic therapy. I will not say it is equivalent to colonic therapy, but it is a type of therapy done through the colon. That is why I would like to call it as colonic therapy for easier understanding. The particular meaning of Basti means the medication or the medicated oil or the mixture is made to stay for a particular period of time in the intestine, especially the large intestine or the colon. That is why Vasati iti, that which stays in some particular place or the space is Vasti or the enema therapy. In that there are 2 varieties. I am explaining a bit more in detail so that the patients or people can understand what to expect when they come for panchakarma. There are 2 varieties in this panchakarma Vasti. One is a smaller variety in which we give mainly oil or the ghee or the unctuous substance as the ingredient of that enema, which may be between 50 ml to 150 milliliters. Yeah? So that quantity will be that much. And it is more of a soothing and nourishing and lubricating in nature. This oil enema. This is called as small enema or the oil enema. Yeah? Matra Basti, Sneha Basti, these are the terms used in Ayurvedic terminology.
This is preferred under what conditions?
This is as a nourishing. So when Vata is high, then we give this nourishing enemas.
So there's too much dryness in the body.
Dryness in the body, or say for example there is constipation, hard stools and such conditions, or even in nervous conditions. The concept of gut brain, if you look into, there is our gut, the intestines, they are supplied with plenty of neurons. And so it acts as a secondary brain or sometimes as a primary brain also. So when we give this enema therapy, that works on this brain or the nerves, and so in turn it will act on the basal plexus, the sacral plexus, all the chakras and at all levels. So Basti or this enema therapy is considered sometimes as half of the therapy, the whole program, or complete therapy itself, because once Vata or the nerves are controlled, the air energy is controlled in body, all other energies and functions can also be controlled. And so that's small enema. And there is one more variety which can be called as big enema or the decoction enema, in which major ingredient will be a decoction or concoction of some herb or herbal combination along with some oil or ghee, and then some powders, paste, honey. These will be a combination which will be triturated well to make a proper combination solution, and then it will be administered, and it stays for very shorter time compared to the oil enema, the small enema. So this larger enema, main purpose is to cleanse the system. So it will flush out all the toxins, and also because of the ingredients like oil and all that, it will have some nourishing benefits also. But main purpose of the large decoction enema is to cleanse the system, not just the intestine, but the whole system and the Vata dosha, the air energy primarily. So when we give as a course of Basti panchakarma, we make a combination of these 2. There may be 1 or 2 oil enemas followed by a decoction enema, the large one, and then again 1 or 2 oil enema, and then again 1 large enema, and then we will end this with 1, 2 or 3 small oil enemas. So that combination, say for 9 days or 15 days, like that it goes, that will work as a complete Basti panchakarma or the Enema panchakarma. And that is a major treatment for Vata dosha or the air energy, and also supports in other doshas that the physician will decide based on what ingredients to use and how much to give, when to give, based on all this. So how do we give this enema? We give it through the anal route. So it is given to the rectum. It goes into the sigmoid colon, ascending colon, transverse colon, descending, transverse, and then ascending colon, like that the whole large intestine. And it is also said that it is absorbed into the system and nourishes the nerves and detoxifies the system through lymphatics also, which is supplied in the intestines. So it is through the anal route. It is mainly for the Vata dosha. It is acting on this part, which is main seat of Vata dosha or the energy. So it is complete or half of the therapy in Vatic disorders, Vata air energy disorders, and it has two varieties, oil and decoction enema. One is mostly nourishing, the other one is mostly cleansing. So this is in nutshell about what to expect in enema therapy. And then I'll just briefly touch upon Nasya therapy, that is nasal installation, in our next episode. Thank you.